Joining me now is Mylea Charvat. She is CEO of Savonix. Savonix is an interesting technology company that is using technology to diagnose Alzheimer's disease. Did I say that right?
Close.
Okay.
Screening.
Screening. Sorry,
We
I should have said screening.
We wish that it was diagnostic. I think we all wish we had, one simple test that would diagnose this really complex disease.
So tell me a little bit about the technology, how it works. I mean, there's a lot of people out there who don't have Alzheimer's, but they're concerned about their memory.
Mm-hmm.
Is this something that they should consider?
And certainly memory is one cognitive component that Savonix tests. We test things like verbal memory, immediate and delayed. We test cognitive flexibility, executive function, working memory, attention, focus. It's a broad spectrum of screening that we offer.
The typical process is you go to your doctor, they give you a MoCA test or something like that, and that's really the first that's the first test that you're given. So what's different about Savonix and what does it offer people?
Well, it's digital, so it's not pen and paper, and I think that's a big thing. It's also both sensitive and specific. So the MoCA is very specific. It'll tell you if you're really cognitively impaired or not. In neuropsychology, it's what we would call a blunt instrument. And what we've developed with Savonix is much more like a precision scalpel. It's really sensitive around discrete changes in cognition. And your doctor would order the test, and you could take it on an iPad or a smartphone in the clinic, or you could choose to take it at home on your own device in your own time.
So is the technology aimed towards detecting Alzheimer's in the end, or is it really for any kind of cognitive tracking and impairment?
It's really for any kind of cognitive tracking and impairment. So memory, I think, is the one that comes up for most people when they think of Alzheimer's. It's not necessarily the first thing to show up as an early indicator. We actually see psychomotor changes, especially in dementia, and we also see changes in things like attention and executive function, so that more thinking, planning, complex reasoning, and working memory is a piece of it. But I think for most people, they focus on memory because it's the most disturbing. I think it's the thing that when it starts to go, you really notice it, and it's very disturbing and creates a lot of distress for the person and for their family.
The alarms don't go off for people and their loved ones until the memory component, right? Are you saying maybe through these tests, can it possibly be a diagnostic tool to early detect signs of Alzheimer's?
So that's exactly what we're going for. We're looking at, it's very sensitive, so it's just discrete changes. So we're looking at trying to find people when they're prodromal, right, preclinical, when they're not yet exhibiting identifiable symptoms from a behavioral standpoint, but you can see maybe compared to their baseline cognitive measure a year or 2 years ago that there's been a real decline that is not normative age-related changes. And that's when those kind of early warning bells could go off.
So what is the test actually looking for if you haven't gotten to the memory stage?
So the test is looking at cognitive flexibility. So cognitive flexibility is what most people think of as multitasking, but it's not really multitasking. What it is the ability to quickly switch attention between two different things and do it so seamlessly that it feels like multitasking. And we call it toggling, cognitive toggling. So that's one domain, and this is actually something that goes pretty early. And it starts to fall off when people start to have when they have Alzheimer's disease. And this is the ability to quickly move back and forth between stimuli and environment, track them both, understand them both, and stay involved in both. Yeah.
Okay, and then are there any other signs?
You're certainly psychomotor changes. Think about like driving is a really good example of a daily skill that requires good psychomotor. So this is about reflex and timing. It's about tracking different stimuli in the environment and responding with fine motor or gross motor responses.
Okay, and in your opinion, when should somebody be tested?
So I personally believe that cognition is the fifth vital sign. I mean, if you really think about things like blood pressure and body temperature, cognition is a much more to me sensitive and accurate indicator of global health. For instance, 75% of cancer patients have cognitive impairment, and 35% of those patients continue to have problems after treatment is stopped. So everybody thinks, it's related to the chemotherapy. What you see is that cognition emerges as a top 3 predictor of treatment outcome in disease after disease after disease. If you can't pay attention, remember working memory, and think and plan, you can't participate in your own treatment. You're just not capable of it. So my idea would be that this is something everybody gets.
Okay, thanks very much.
Yeah, thanks for having me.